Oh dear. Oh dear. Okay, Mrs. Smith, take a look in the mirror. No, not of me, in the mirror. No, not there. There, where my finger is. Now, look, as you can clearly see, you've got a serious transverse fracture of the palatal cusp of your upper right thigh. It's extending subgingivally well below the sulcus, and I shouldn't be surprised if we're looking at a close exposure here. You may well need an RCT, and at the very least you will need some gingivoplasty, and then I'll have to fabricate an indirect restoration from lithium disilicate, or even use CAD-CAM. Do you agree? Sorry, I didn't quite catch you. Do you agree? Wonderful. Okay, in that case, go back to reception and we'll make you an appointment. Well, nurse, you better give a consent form to Mrs. Smith.
She's already left the building.
Really?
Yeah.
How odd. Okay, that might have been a little extreme, but those of us who work in busy practices can easily see the sort of pitfalls that we can fall in. Okay, so golden rule number 1, put your patient at their ease. Get rid of all the paraphernalia. And remember, what's simple for us to understand may seem extremely complex to a patient. So speak slowly and clearly. If the patient's sitting, sit next to them. Or if they're standing, stand by their side. Better still, carry out the treatment plan proposals in a non-clinical area. But if you can't do that, at least move away as much of the scary dental equipment as possible. Golden rule number 2. Use clinical photography. A picture really is worth 1,000 words. And unless you're trying to show a patient something at the very front of their mouth, a mirror, honestly, is useless. Remember, patients have a great deal of trouble interpreting dental x-rays. Think how long it took us to learn how to do it. So avoid those whenever you can. And also remember that even anatomically correct models like this one may be very difficult for the patient to identify with, because this really doesn't look like that little white lump that sticks out of your gum. Golden rule number 3. Avoid the dentlish. Patients really don't understand it. Throw out the technical terms and speak in words they can easily understand. Now, that's not only essential to gain informed consent, but it's actually far more effective. Golden rule number 4. Involve your patient with the treatment planning. Give them options. Everything from leaving the tooth alone to carrying out comprehensive treatment, explaining the benefits and the drawbacks of each treatment modality. Ask them for their comments. Let them be part of the treatment planning process. And the bonus golden rule: do as you would be done by. We're all patients ourselves from time to time of various other health professionals, and we may not understand the treatments that they're presenting or the conditions that will be put under. Try to put yourself in your patient's shoes, and then you'll very quickly understand how important empathy, kindness, and good communication really is. The British Academy of Cosmetic Dentistry offers regular training courses on clinical photography, and at their annual conference and their many regional meetings, they run courses on all aspects of patient management, including good patient communication. I recommend you join.